We're going to talk about the flu shot, but I just wanted to start out talking about the updated COVID vaccine because I think that one, it's hard to get solid information about right now. So I'm going to make sure we gave you the most up-to-date, accurate information about how to get it. It's a new shot. It's not just the same one over again. The updated vaccine protects against the newest COVID variants. It's available to all New Yorkers who are 6 months and older. There's different versions of it for younger children, but there's a version of it available for everyone 6 months and up. There was some confusion or some red tape around this idea that you needed a prescription in order to get the COVID vaccine. You do not anymore in New York State. So you don't need a prescription from a doctor. They can just go ahead and give it to you in the pharmacy when you go there and get it. So don't think that you need to make an extra trip to a doctor or call your doctor or anything like that to get a prescription. You can call your doctor with questions if you want to, but a prescription is not necessary. And we'll talk a little bit more about that. So the reason that this prescription is not necessary is that New York State Governor Kathy Hochul signed an order making it so that pharmacists could provide the vaccines without a doctor's prescription. There's been a lot of red tape from the current CDC. It's really hard to trust what's coming out of the CDC right now. So I wanted to give you some other sources of accurate information. But just know that New York State has that. I think it's New York State and 34 other states have done this where you do not have to have a prescription to get the updated COVID-19 vaccine. The one thing I would say is you should get it as soon as possible because this executive order is something that has to be extended every 30 days. So right now, this is all true through November 5th. But policies can change. We know about the uncertainty going on right now. I would say go ahead and get it while you know that you don't have to get a prescription, while you know it's available. The text of this executive order in both English and Chinese, I think it's helpful to see because it's confirming the state's commitment to making sure that everybody has access to the new COVID-19 vaccine. New York State is involved with multiple other states in the Northeast of making sure that they're giving out accurate health data and recommendations for vaccination. So I think it's good to see that they're being real straightforward about their commitment to making sure that everyone gets vaccinated. Then as far as the city goes, I have this statement on the right from the acting health commissioner, Dr. Rochelle Morse. This is just, again, a statement of vaccines are safe, vaccines save lives. We're not going to restrict access to vaccines in New York State or New York City, and that we are committed to taking care of the health and safety of residents in New York City, supported by facts grounded in science. So it's good to see the city making that commitment as well. Let's just do a little COVID-19 vaccine review. I just want to go over some of the COVID-19 vaccine basics, just so we remember, because all of these things remain true. And I just want to show that we continue to be committed to this as well. So COVID-19 vaccines are our best protection against COVID-19. Anyone can become very sick from COVID-19 and everyone should be vaccinated. Even if you've already had COVID-19, new variants are evolving all the time. That's why we have this updated shot. Chances are we will have an annual shot like the flu shot. That seems to be this thought of what's going to happen in the future. So this is the most updated vaccine and it's a super effective one. We'll talk about that in a little. If you get COVID-19, again, vaccines reduce your risk of long-term health effects, including long COVID. Just because you get the vaccine doesn't mean that you won't get COVID. You may get COVID, but the likelihood of you being hospitalized, having serious symptoms, dying, God forbid, or having long COVID is very much reduced by getting the vaccine. So you are giving yourself that protection. Location, the rollout of this has been a lot less straightforward than it was last year because of the current administration, the current head of the CDC. New York City is trying to fill in those gaps. So they are working on updating the health map that used to be Vaccine Finder to show locations where the vaccine is available. Right now, check with your health provider and check with your pharmacist. I will show you the steps for making a pharmacy appointment. Even though the map isn't updated, pharmacies have it and are happy to give it to you. Again, this was said in the last slide, but if you get COVID-19, vaccines reduce your risk of long-term health effects, including long COVID. If you've had COVID, still get the vaccine. The vaccines are now designed to protect against the newest variant. So they boost your protection against the virus, which is important too, because the protection of your last shot, it goes down over time. So not only are new variants evolving, but also you lose some of the effectiveness of that shot over time. So you need a booster. And that's what this does for you. Everyone should stay up to date with their vaccines. For most people, that means getting one updated 2025 to 2026 COVID-19 vaccine dose. There may be different standards for people who are immunocompromised or for children. I'll give you some information about where you can find all that as well. But for most people, it's going to be one shot for the 2025 to 2026 season. And you can get the updated COVID-19 vaccine at the same time as other vaccines like your flu shot. You can get multiple vaccines at the same time. That is a personal preference. I got my COVID-19 and flu shot at the same time because I figure if I'm going to have a sore arm, I might as well have a sore arm once instead of twice. But again, it's up to you. Just make sure you do get them. This is a super effective COVID-19 vaccine that we have right now, the 2025 to 2026 version. So the early data about the effectiveness of this particular dose is that those who get the 2024 to 2025 shot in particular have 4 times as many COVID fighting antibodies than those who didn't. It may be the most effective shot that we have so far. 4 times as many antibodies is a whole lot. So I really do want to underscore how effective this can be in terms of helping your body to fight COVID and to fight off anything that would be a more severe manifestation of COVID-19. I also wanted to talk briefly about the flu vaccine because now is the time of year for that too. Again, you can get them together, the flu vaccine and the COVID-19 vaccine. Flu vaccines, like COVID-19 vaccines, safe, best way to protect yourself against getting sick with the flu. Also, like with COVID, it reduces your likelihood of getting severe illness, being hospitalized, or dying from the flu. So same again with COVID, everyone aged 6 months and older should get a flu vaccine every year, even if you've received that flu vaccine in prior seasons, because the strains of flu that go around every year are different. And the scientists who make the flu vaccine are doing a lot of research to figure out which variants are going to be circulating. You need to get your flu shot every year because it's made for that particular year and the flu forecast of which variants are going to be in circulation. And the best time to get the flu shot is at the beginning of respiratory virus season, which is right now. So September or October, I would say as soon as possible. I know there have been years when I have waited to get the flu shot and it was not the smartest decision because I actually ended up getting sick before I got the flu shot earlier rather than later, and you'll be protected throughout the season. And especially now, since you have a good window of opportunity with the COVID vaccine, go ahead and get your flu shot. If not at the exact same time, get them close together just so you are covered and protected. So this is a little segue to where can we find reliable health information right now? As we spoke about this time last year, we were very much dependent upon the information coming out of the CDC. The CDC has changed a lot and is not listening to doctors and scientists in the way that they were before. So I wanted other reliable sources of finding this information. Like I said, the city is very much committed to continuing to do this science-based promotion of vaccines and other health information. So the New York City Department of Health's vaccine page is a great resource. They're updating it a lot. If anything about that changes, I will let you know. And we are very much committed to making sure we get you the right information. So as we get a sense of who has the most accurate information, who's keeping their sources accurate, we'll make sure that you know that. And we'll give you those updates based on the science-based information that's coming out and is being supported by doctors. And then if you are interested in learning more about vaccine schedules for children, whether you have a child, a grandchild, the Academy of American Pediatrics website is a great source for seeing what vaccines they are saying that children should get at particular ages. So it's a full vaccine schedule. That is a organization made up of pediatric doctors. So that is an organization that you can trust. If you have additional questions about vaccines, either for adults or children, you can always talk to your healthcare provider as well. And we encourage you to do that if you have questions about your own eligibility. So where can you get your 2025 to 2026 COVID and flu vaccines? So pharmacies seem to be your best bet right now. You can check with your healthcare provider. So CVS, Walgreens, and Costco currently have them according to their websites. Walgreens offers walk-ins, but it might require you to wait a little bit if you make an appointment. You may still have to wait for that too, but an appointment might streamline a little bit more for you. Just to give you an idea of what the process was for me, I did a walk-in, just went in and told them that we wanted to get our COVID flu shot. They had us already in the system. We waited maybe like an hour just from a walk-in. So it was a little bit of a wait. Take your phone, take a book, take something to keep you occupied while you're waiting. But the wait was totally worth it. Once they were ready for us, it was in and out very quick. Got both of them at once and we're good to go. So just keep in mind that there may be a little bit of a wait. great. Even if you have an appointment, especially if you have a walk-in, once you get it done, it's done. You got it done for the season. That's great. So I wanted to walk us through scheduling a vaccine appointment. I'm going to use Walgreens as the example. It's real similar to what you've done in the past, but I just wanted to walk you through it in case you're needing to do that this time around as well. There's a couple little different things, but not much, but we'll go through it. So practicing with Walgreens, if you do it with CVS or Costco, the process will be a little different. Like the fields that you enter might be a little different in the order you enter them in, but it's going to be quite same information. So let's go through this quick. You're going to go ahead and open your browser and type in Walgreens.com, www.walgreens.com. And you should see a page that looks like this. Let me show you that last screen. That'll be the screen that you see when you go to Walgreens, and you'll see this button that says schedule vaccinations. That's what you're looking for. Then you're going to click on schedule vaccinations. So you'll see up here that there's a update that the COVID-19 vaccine is available. And then it'll give you the option of doing English or Spanish. If your phone is set to another language, it should automatically translate the site anyway, but those options will be there for you. If you are looking for an appointment in a particular location, just put in your home zip code if you want to get one close to home, wherever you're trying to get it. And then you can say if it's for an individual or a group of 2 to 4. So if you are bringing family members, if you have kids or grandkids that you want to bring, you can make an appointment for multiple people at once. Just be aware that the only vaccines that you can get if you're doing that in a group are the flu and COVID ones. So if you want any additional vaccines, you need to do that as an individual appointment. But if you just want to take a group in to get your flu and COVID vaccines, you can do that with a group of 2 to 4. I'm going to say an individual appointment. Go ahead and enter your date of birth, your email, your phone number. If you want to get a text message, they'll email you information if you don't sign up for text messages. But if you're okay with getting a text message from them, go ahead and check that. After that, you're going to say next, and it will ask you what vaccines you want to get. There are tons of vaccines on here that you can potentially get. We're talking about the flu and COVID today, but scroll down. If there's anything that you think you might be eligible for, you can always talk to the pharmacist once you get there too. They let you do up to 4 vaccines at once. So if there are things that you have been putting off that they have available, it's a good time to get those on there as well. And then you're going to confirm your eligibility for the COVID-19 vaccine. In some states, this is more up for grabs. In New York State, they have committed to making sure everybody has access to the vaccine. So you go in and say, yes, you're eligible. You don't have to do anything like have a prescription or anything like that. So just say, yes, the patient is eligible. And then they might ask you if there's a handful of vaccines that they're promoting. So if you need to get your pneumonia, Tdap, hepatitis B, they just give you another option to add those to the list of ones that you're going to get. So you can either add 1 or more of those or say no thanks. And then you will get a list of times that are available for appointments. Just so you know, I made these slides yesterday, and these appointments were all available yesterday. So on the 17th, we had 5, 5:10, 5:20, 5:30. I know there were times when you had to wait for a week or weeks to get your vaccinations. That is not the case right now. And I say strike while the iron's hot. In this example, I got same day appointments. I tend to think that you can get them pretty fast. So click on the time that you want. It's going to ask you a little more information about yourself, demographic information, your first, last name, sex, race, ethnicity, that sort of thing. Then you can just review all your information. So scroll down, make sure everything's correct, and say book appointment. And you should be good to go. You'll get either an email or a text message or both confirming your appointment. One thing I wanted to note is that if you're going to a pharmacy that fills prescriptions for you that you're already in their system, they probably do have your insurance information on file, but you should take your insurance card just in case. If they need to update anything, it's good to have it just in case they need additional information or if their system isn't up to date. And most insurances are covering the COVID and flu shots. If you need to check with your insurance beforehand, give them a call, but I think it's pretty standard that those are being covered. But if you want to double check, that's not a bad idea either. So just to summarize some key points here, vaccines are safe and effective. The 2025 to 2026 2026 COVID-19 vaccine is the most powerful tool we have to prevent against severe illness, hospitalization, and death from COVID. It also helps protect you from getting long COVID. It's available at pharmacies without a doctor's prescription, thanks to this New York State executive order. You can get it at the same time as your flu shot and other vaccinations. Get them as soon as possible. There's a lot of uncertainty about going forward what the process will be. So we have this open window. You can get it at a pharmacy without a doctor's prescription. Hopefully what it says right now with the executive orders through November 5th, but don't wait. Do it while you can. If you have any questions about your own eligibility or anything about your own personal situation, talk to your healthcare provider and they can point you in the right direction. But the general guidance is everyone get it. It's the best protection you can have. And for accurate vaccine information, you can visit the New York City Department of Health's vaccine page and the American Academy of Pediatrics for vaccine guidance for children. The CDC is not the best source of information right now, unfortunately. We will keep giving you resources that are prioritizing science-based, doctor-led information that is accurate.